Hello students. So today's topic is hydrocephalus. Hydrocephalus is a Greek word and hydro means water and cephalus means head. That means water within the head or water inside the brain, right? So hydrocephalus is by definition is the condition where there is abnormal accumulation of the CSF inside the brain within the brain cavity and which causes ventricles to enlarge and increase pressure buildup inside the cranial cavity. So there is two things, ventricles to be enlarged, either ventricles to be enlarged or there is ICP which is going to be increased, right? So today we are going to discuss about the classification of the hydrocephalus. So hydrocephalus can be classified in different ways, right? First is communicating or non-communicating, then congenital or acquired, pediatric, infantile or adult, acute, chronic, high pressure, normal pressure hydrocephalus, ex vacuo hydrocephalus or arrested hydrocephalus. It is also called as compensated hydrocephalus. So what is the difference between the communicating and non-communicating hydrocephalus? The communicating hydrocephalus, in this hydrocephalus, either the production of CSF increased or the absorption which occurs at the level of arachnoid villi. I already have taken the class on it. So that absorption is reduced. So production is high or absorption is reduced, right? The site of block is at the level of arachnoid villi or beyond or post arachnoid villi, that means in the venous sinuses, right? The hallmark of the communicating hydrocephalus is dilatation of entire ventricular system because the obstruction is at the level of arachnoid villi, which is the last part of the CSF. The ultimately CSF is getting absorbed in the arachnoid villi. So all the path is non-obstructive. So there is entire ventricular system which is going to be enlarged, right? With what is non-communicating? Non-communicating, as the name suggests, it is there is no communication. That means the CSF pathway is obstructed. So there is obstruction at any pathway, at any point of the CSF path, right? So the site of obstruction is at and proximal to the outlet of the fourth ventricle. There are two outlets in the fourth ventricle. I have already mentioned it, foramen magendi and foramen lashka. So these foramina, they get occluded or proximal to it, right? That means either the foramen Monro is occluded or the cerebral aqueduct is occluded or the foramen lashka or magendi, it is occluded. So the enlargement hallmark is dilatation of ventricular system or CSF pathway which is proximal to the block. Suppose the one foramen Monro is obstructed, then what will happen? The one lateral ventricle, it is got enlarged, and if both the foramen of Monro occluded, then both the lateral ventricle are enlarged. Suppose there is a aqueductal stenosis, cerebral aqueductal stenosis, it connects third ventricle to fourth ventricle. That means कि proximal to the obstruction, that means proximal to the cerebral aqueduct, there is third ventricle and lateral ventricle. So all the three ventricles are enlarged. So this is the hallmark. Proximal to the obstruction, there is enlargement of the ventricular system in obstructive or non-communicating hydrocephalus. So what are the causes of communicating and non-communicating hydrocephalus? So the communicating hydrocephalus causes are congenital. We divide it into two, congenital or acquired causes. In congenital hydrocephalus, there may be achondroplasia, craniofacial syndrome and skull-based deformities, right? In acquired causes, there may be choroid plexus papilloma or carcinoma which cause increased production of CSF. There may be subarachnoid hemorrhage, interventricular hemorrhage, or in infections also like meningitis, encephalitis, the hydrocephalus can be seen, and cavernous sinus thrombosis, there is communicating type of hydrocephalus. Let's see about the non-communicating hydrocephalus. The causes are, it is also divided again into the congenital and the acquired causes. In congenital, there may be spina bifida, vein of Galen aneurysm, meningomyelocele, Arnold-Chiari malformation, Dandy-Walker syndrome, aqueductal stenosis. I have already mentioned it, right? And in acquired causes, there may be the tumor may be the cause. Post-inflammatory adhesions, it can also cause obstructions. The cerebellar hematoma, because we all know the cerebellum is situated just behind the fourth ventricle. There may be cerebellar hematoma, there may be cerebellar infarct, there may be abscess, right? There is another, there are some terminology I can explain one by one, right? So first we will talk about uh, what is congenital hydrocephalus or what is acquired hydrocephalus. The difference between the congenital hydrocephalus is that the congenital hydrocephalus, it is present since birth. It is present since birth, at birth, or it develops a few months of the birth, right? And what is acquired hydrocephalus? Acquired hydrocephalus, it develops later in the life. That means after years or after few days or after few months of the life, right? And it is associated with the or they it is as a sequelae of some causative factor, right? What is pediatric adult? That means if it is divided on the basis of the age of the patient. If hydrocephalus seen in the pediatric patient, that it is pediatric hydrocephalus. If it occurs in the adult, that is called adult hydrocephalus. What is acute or chronic? Acute is always abrupt, right? That means acute in onset or abrupt in onset, right? It always associated with the signs and symptoms because there is raised ICP, right? And what is chronic ICP? Chronic hydrocephalus means it occurs over a period of time. Means in acute it occurs within few days, and in chronic it occurs over a period of time. That means few months, few years after it develops signs and symptoms, right? In chronic it is like compensated hydrocephalus. That means the ICP initially rises, but later on it is more or less within normal limits. So in chronic hydrocephalus, we also call it normal pressure hydrocephalus, right? But in acute hydrocephalus, the surgical intervention is needed, like external ventricular drainage or some shunt to be planned. But in chronic, we can, follow up. We can follow up these cases, and that intervention may be delayed, right? Then what is high pressure? It is normal hydrocephalus. That means ventricles are enlarged and the pressure is also raised. Then normal pressure hydrocephalus means ventricles only enlarged and the pressure is within the normal limit. It may be at the higher side of the normal limit. Then what is ex-vacuo hydrocephalus? So ex-vacuo hydrocephalus is also called as hydrocephalus in emptiness. As the name suggests, it is basically seen, emptiness means it is basically seen in elderly. You can remember by E, elderly, because in elderly there is brain shrinking, maybe because of the Alzheimer's disease, maybe because of the stroke or post-trauma elderly patient, right? The brain is shrink, so there is a pressure on the ventricles and the ventricle pressure is raised. But the ventricle pressure initially raised, but it gets normal over a period of time. So the ventricles are enlarged. Here it is also the ventricles, they are getting enlarged. Ventricles, they are getting enlarged. So it is called ex-vacuo hydrocephalus, or it is the hydrocephalus of emptiness. It may not show any sign and symptom also, and pressure is normal, but ventricles are dilated. And the what is arrested hydrocephalus? Arrested hydrocephalus is also called as compensated hydrocephalus. As the name suggests, compensated. That means initially there is rise in the ICP. Ventricles is dilated, no doubt. Initially there is rise in the ICP, but later on it gets compensated and the ICP becomes normal, and it shows like it is also called as normal pressure hydrocephalus because ventricles are only dilated and there is no rise of ICP, and it may not show any sign and symptoms of hydrocephalus. It is not requiring any surgical intervention. Okay, so this is called arrested or compensated hydrocephalus. So this diagram, I can draw this diagram to make you understand about the ventricles. Okay, so suppose this is your head. Okay, this is your head and this is the lateral ventricle. This is lateral ventricle. Okay, this is lateral ventricle and this is third ventricle, and this is aqueduct of Sylvius. Then this is fourth ventricle and this is continuing as a central canal of spinal cord, right? So this is head and this is head. Okay, and here it is cerebellum behind the fourth ventricle. This is the fourth ventricle, right? And this is the third ventricle. This is lateral ventricle, and the part of lateral ventricles are, this is frontal extension of lateral ventricle, this is body of the lateral ventricle, and this is occipital extension, occipital extension of the lateral ventricle, which is basically found in the occipital lobe, and this is temporal extension. This is temporal extension of the lateral ventricle, right? This is third ventricle. Here between the third ventricle and lateral ventricle there is foramen monero. This is cerebral aqueduct, and this is fourth ventricle, this is central canal, right? So in obstructive type of hydrocephalus, as I have mentioned earlier, either there is obstruction in the foramen monero or cerebral aqueduct, or there is outlet in the fourth ventricle, foramen magendi and the Lashka. They, either of them get clogged or obstructed by emboli, by thrombus, by anything. Okay, so this will create obstruction and that will cause this lateral ventricle to enlarge. Okay, these lateral ventricle to enlarge. Suppose the obstruction is at the level of cerebral aqueduct, so third ventricle and lateral ventricle all are enlarged. So this is all about the hydrocephalus. Hope you like it. Thank you so much.